Hey, I realized that there is another thing that is happening right now that's kind of a unseen problem or a less pointed out problem, but we need to talk about it. And that is that both Richie and I had our therapists cancel on us yesterday. I don't know if they were both are actually sick or if they both happened to be immunocompromised for some reason, and so they just needed to be out. But and we're okay. But I just realized, there's so many people right now who are already needing regular mental health services that are going to have their access taken away. And from what I understand, there is some trouble right now with mental health practitioners getting insurance to approve telehealth. Hopefully, within the next 24 hours, that should go away. We'll see. I'm trying to find out and keep updated with the people that I know that are actually billing and getting paid for this stuff, and trying to actually deal with the insurance companies and seeing whether or not therapists are actually able to get paid the way that they should be. But because therapists have to be able to do telehealth right now. Not only do we have all of these people who need their regular mental health care, we need to make sure that we're not leaving so many people unable to cope with the panic and the trauma of what's happening right now, and flooding into the ERs because of psychiatric crisis. The last thing someone in a psychiatric crisis needs is a physical illness as well. Like, that is going to be horrible for everybody involved. And people with mental illnesses, a lot of times our medications have effects on our immunity anyway. A lot of different medications and mental illnesses come with side effects that make self-care and keeping clean and good habits and all that stuff really difficult. And so the mentally ill are already a vulnerable population. And so now I'm just realizing, okay, if we're having canceled appointments because therapists are having trouble being able to do telehealth, and people are going to end up with restricted access to their healthcare providers, and mental health is absolutely a vital part of our whole being. It is a part of our physical health. They're definitely not separated. And so we needed to just really take seriously what's happening and make sure that we do not forget the mental health care providers that are working right now, and ensure that they are also given all the tools that they need to get their jobs done and to be able to weather the crisis themselves, and then support all of the rest of us while we are trying to weather this storm. It is absolutely vital that we do not leave behind therapists, psychiatrists, all of the different mental health care providers, and then all of the medications that people need while they are treating mental illnesses, because some of these are controlled substances, some of these things need regular monitoring of blood levels and things like that, and we need to make sure that people still have access to this care and that it is prioritized, because it's gonna end very badly for a lot of people if we do not take this into consideration.